Rue was bred by a good friend of mine. She taught me how to ride when I was tiny. He would just rear and squeal and go upright for absolutely no apparent reason at all, but it was just totally reactive because he couldn't cope with his body, I suppose. He was in so much pain. He was in his routine. He'd go out in the field, he'd come in. To lead him was horrendous. He'd spend all day, it's like a vertical flick, tick, they call it. But he was in excruciating pain, and it was just horrendous to see.
We found it difficult to actually get to the source of what that pain was, why he was reacting the way he was.
It just came to our knowledge by accident, and we figured out a timeline. I moved them away from home for 3 months, and the stable roofs were quite low, someone had belted him across the face, and he'd done that. And then it was 6 months after, he started to be symptomatic, and then in 2 weeks he was horrendous, and that's when you saw him.
I've always worked on the principle, if they start mucking about and being difficult, there's usually some reason for it. It's usually pain related.
Rue's attitude isn't bad, but he doesn't suffer fools gladly, does he?
It was a long way. And he had so many tests, CT scan. He was diagnosed with the Trigeminal Mediated Headshaking. This was me and his owner, breeder.
We had spoke to a couple of practitioners, and they all turned around and said, oh, it was the way he was schooled, and was very insulting to Sadie, and don't think very much of them no more.
So he had the treatment that they suggested, and it didn't work. So they suggested then euthanasia. At the time I was studying, and I understood the philosophy behind osteopathy, I kind of wondered, well, what if it could work? What if we haven't tried it?
She was able to go to her tutors, and they helped her out. She had connections that she could speak to and ask questions.
I'd like you to be able to learn from each other as well. So
I started with the LCAO on the onset of his issues. The theory and the online study, I was very lucky I had horses here, so I could work and practice on them. Had I done it any other way, I don't think I could have done it. I did a bit of work around the ear. That gave me a window to get in, and then I did positional release basically through his neck, and then over a course of a few months just worked down through the neck, down through the back.
I've been in the horse industry all my life, so I've always looked for alternative therapies. And as the world of equine has changed, you change with it. You cannot stay in the past.
Although we had a diagnosis, I just wanted to try other stuff before we completely gave up.
Of course, yeah. So what did you do then? What was your actual technique?
Oscillation, but trying to get the joint mobile again, because he was so stuck.
What, the atlanto-occipital joint?
Yeah.
Right.
That's where it originated. As time went on, it went all the way down through his body.
Is he now completely rideable?
Yeah.
And would if I was to see him now and see you riding him, would I even suspect he was a head shaker?
No.
I'm a horse vet, recently retired after about 40 years, and I've worked as a lecturer in 3 veterinary schools teaching vet students. I think the sort of overlap between osteopaths and vets in terms of communicating what an osteopath is doing and what the science behind it is, I think is quite limited, and there probably is definite room for improvement there.
Thinking osteopathically, you look at him in certain stages and think, this is moving, that's not, but why is that happening? And kind of join the dots rather than just looking for a problem. It was looking at the whole picture.
For a horse to be a performance athlete, it needs to be treated like one. So osteopathy, to get everything right, is a key component to your fitness and your training and your performance of your horse.
So when he started to change and he'd calm down and his head would come a bit lower and his posture changed and he was more relaxed and more comfortable in himself, you only had to look at him and go, well, he was like this and now he's like this, so that's better.
It sounds to me like osteopathically, you've already helped him quite a lot. I think what you've done is amazing.
Thank you. Yeah. I wouldn't go as far to say he's cured,
No.
because it's one of those conditions.
But you've
that,
caused a huge improvement.
yeah, yeah.
For you,
and
you
he's-
know, an unrideable horse that probably would have been put down is now completely usable.
Yeah, yeah.
It's fantastic. Well, very interesting. We need to consider this, I think, in future cases, definitely. Particularly when everything else has failed.
I hope and I wish that we keep moving forwards, and we are at the moment. Some days it's a bit disappointing. You think, oh, you go back again, but actually it doesn't seem to stay for very long. Even if he's having a bad day, he's not distressed like he was before.
People did say if he was in anyone else's hands, he'd have been put down.
Sadie was able to treat him as much as she could, have the knowledge, have the resources, and have people in her corner.
This is when
We would just get him going.
It's been really interesting working with her because I've known her since she was a child, you know, really young. I think because of her training and the osteopathy part, it's allowed her then to evolve and develop that more. I think that's what kept her going.
I believed in Sadie all the way, all the time, and everything she was doing and trying to do, you know. And I don't know how many people actually do.